Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So in today's session, we are going to learn about Integumentary System CPT coding guidelines, which is very important for CPC exam. So I will walk you all through 5 key multiple choice questions and you can learn the correct answer and understand the coding guidelines behind them. So let's begin. So let's see our first question. When coding an adjacent tissue transfer or rearrangement following excision on same site, which coding is correct? So on the same site, if they perform excision procedure and then if they perform ATT procedure, which one we have to consider is the question. So you can check the option. Option A says report both the lesion excision and ATT code separately. Option B says only report the lesion excision and ATT is bundled and not coded separately. Option C, report only ATT code and excision is included in it. Option D, use the larger code between the excision or ATT only. So let's see the correct answer. The correct answer is option C. Okay. Report only ATT code and excision is bundled with the ATT procedure. So we only report the tissue transfer code. The defect size and the recipient site determines the code selection and the excision is already bundled with the ATT procedure. Okay, so correct answer is option C. And also if you get ATT plus simple repair, then the simple repair is also included in ATT procedure. So yes, let's go to next question. Second question, when two wounds are debrided at a different depth, how should this be coded? So the correct answer here is option C. Code each depth separately and do not combine the surface area across different depth. Okay, if the wound depth falls on the same depth area, okay, multiple wounds are present, but when you look into the depth, the particular first site is also falls in subcutaneous level and other site is also falls in subcutaneous. In that case, you can add the square centimeter and you can code a single code. But in our question, they are saying wounds are debrided at a different depth. For example, one site is at subcutaneous and another site is at muscle level. So in this case, we cannot combine them. So instead, we have to code them individually. Okay, according to their depth, we have to code them separately and we should not combine the surface area across different depth. Okay, so option C is correct. So next, during the same session, physician performs FNA of two different lesions, one guided by ultrasound and another guided by CT. How should this be reported according to CPT coding guideline? So if you check the FNA coding guideline, so here on the same session, on same lesion, the provider is utilizing two different imaging modalities. Okay, so when they use different imaging modalities, you should assign them individually. Okay, you can code them separately utilizing the guidance primary code with the using 59 modifier. Okay, so the correct answer again here is option C, which says report each FNA with appropriate modality specific code and append modifier to the second procedure. So here you have to use 59 modifier here and you have to code both ultrasound image guidance one code and CT image guidance one more code. Okay, so option C is correct. Fourth question, a malignant lesion is excised and the defect is closed with an extensive layer undermined complex closure. How is this coded? So in this scenario, whenever the provider is performing excision and closing that particular site with a simple closure, then that simple closure is included in excision procedure. But here in our question, they are performing complex closure. So the correct answer is option A, both excision and complex closure coded separately. Okay, you must code them separately since they have performed complex closure. I repeat, in the place of complex closure, if you got a simple repair, then that simple repair you don't have to code separately, just code excision procedure. Okay, if you get intermediate and complex closure along with the excision, then you must code them separately. So for this question, option A is the correct answer. So next, last question. If biopsy and more definitive procedures such as excision are performed on the same lesion during the same encounter, which coding is correct? So as you all know, with the definitive procedures like excision and destruction procedure or shave removal, the biopsy procedure is a routine component. Okay, it's an integral procedure, so that whenever they are performing biopsy and the definitive procedure, only definitive procedure will be coded and biopsy will be an integral component or an integral or a bundled procedure with the definitive procedure. Okay, so for this particular question, answer is B. Report only the excision, which is definitive procedure. So in this definitive procedure, they may question other procedure also. Okay, you can just go ahead and check the biopsy coding guideline in the CPT book. You can see example as destruction, shave removal. Okay, all of those are considered as definitive procedure. Along with those definitive procedure, if they are performing biopsy, then you should not code for biopsy. Okay, so for this particular question, option B is correct. So yes, I have took some 5 coding guidelines, and there are too many coding guidelines from Integumentary system. And to learn everything, you can join my CPC exam preparation classes. So you can get classes, you can get notes and the practice question. Also, you can get all chapter CPT coding guidelines. Okay. So to join the classes, please do WhatsApp me. I have given the number. And if you like the video, please do subscribe to my channel and please do share with your medical coding friends. Thank you all.